As part of the SURE program, we stayed on campus here for the summer. We worked with our faculty mentors one-on-one to really work on the project, get in depth with literature review, data collection, and statistics.
SURE is definitely important because it allowed me to focus on my research and not worry about classes and my extracurriculars and my volunteer and things of that nature. I was really able to hone in and focus on what my research is and why it's important to me.
So my research is looking at how gender-related frames and mental health-related linguistic frames can affect perceptions of individuals. So we'll be looking at that in an experiment, but in order to do that experiment, this summer we had to identify frames that are related to gender and mental health. So we gathered words from previous research and we added our own, and we asked participants to essentially rate them on how related to gender and mental health they are, plus a number of other scales to control for other potential factors. And we indeed found the frames that we need. We were able to replicate previous research as well.
I'm studying the triadic communication interactions between patient, caregivers, and providers in relation to the human papillomavirus vaccination, or the HPV vaccination, in Latina adolescents. I've been working very closely with community members to better understand this topic. I'm trying to understand what's happening as far as why Latina adolescents aren't getting vaccinated as much as their white counterparts in the community of Alamance County. So really working with the community right now, I'm working on recruiting participants.
So the research that I did, I looked at depression and baseline neurocognitive function in student athletes. So what we wanted to do was compare the symptom score on the IMPACT, which is a baseline measure of neurocognitive function, and compare that to the Beck Depression Inventory, which is a psychometric evaluation of depression. When we did that, we found that the total symptom score for the IMPACT was significantly correlated with the Beck Depression Inventory total. When we found that, that was very interesting to us because it means that if you have certain groupings of symptoms, such as trouble falling asleep, sleeping more, or sleeping less on the IMPACT symptom survey, you could be more at risk for having depression. And what we want to do is really create an educational tool where we can provide resources to individuals who may have these groupings and say, hey, maybe you do want to get checked out and see if you are more at risk for developing depression.